inflammatory in our bodies. And so are a lot of these oils, other than what I talked about with virgin olive oil or coconut. The other oils, are just notoriously bad for inflammation body-wide.
Canola oil,
Canola oil is a monounsaturated oil, but I haven't read, and there's a lot of controversy whether canola is good or it's bad. But there have been found a lot of toxins in canola oil, which can affect your liver, which can cause you more inflammation. So I just say with canola, I just stay away from it. I'd either use extra virgin olive oil or coconut oil, or if you need to fry something, which you shouldn't do anyway, sesame oil might be another third choice as far as oils are concerned. But I think if you want the flavoring of oils, you're better off if you could bake or roast or broil something, and then just drizzle some olive oil on it at the end, and you can still have that same kind of an effect without actually frying it.
Yeah, I think of my granddad so many times. We lived on a farm and butcher a hog, and my grandmother would fry that fresh side meat.
Sure.
Which would render a cup full of grease.
Oh yeah, yeah.
And for his dessert, what did he have? Bread and butter dipped in that grease. He'd consume the whole cup of grease.
Yeah.
Even, I guess I
He
did.
lived to be 87 years
But
old.
you know what? You think about the time he lived. The foods that he probably ate, they weren't contaminated. They weren't toxic. The water he's drinking, we don't have all these chemicals and all this junk in it. He's probably not eating any processed foods that we're all eating. It's such a different time. Even the amount of stress we have in our body can affect how our bodies respond to inflammation and heart disease. And during times, even though there was stressor, just trying to get food and shelter and that, it was less stressful, I guess, on our body, the way it taxed our body than it is now. So, and probably back then you could get by with it and do just fine. If you did it now, you probably couldn't because of where we live now.
My mom passed away in 93.
93.
Yeah.
She fixed eggs. Well, first they grew their own meat, pork, hogs. She took that old fat back, fried out, frying eggs. And she'd take 2 spoonfuls, big spoonfuls of grease and put it on each egg.
Yeah, yeah.
And once it was out, she sopped it up with biscuit.
Yeah, yeah, yeah. And you can get by with that.
But she cut.
But you know what? One thing about eggs too. Eggs have always taken a bad rap with cholesterol.
Yeah, I was going to ask you about that.
Yeah, they're not. Your liver is going to produce as much as you need, and diet can have about maybe 20–25% effect on your cholesterol levels. But again, if you're eating the right kind of foods, and eggs are not inflammatory to your body, by the way. And the good eggs to buy too are some of the omega-3 eggs, because they feed the chickens omega-3. So you can actually get some omega-3 in your eggs. But don't worry about eggs. Eggs are fine. They're not inflammatory. They are not going to have an adverse effect on cholesterol. And if you read anything in the current medical literature, eggs are not a bad thing.
I'm glad you mentioned that, because that was...
Yeah, because your body's going to produce it. I mean, you can't, other than taking a statin drug to knock down the cholesterol production in your liver, I wouldn't worry about it. Eggs are fine. Eggs are fine.
Okay. Very nice, very informative.
So what I'll do is I'll get you some, next time I see you, I'll give you some omega-3s to try.
Okay.
Try these and see. And what we'll do is just kind of stair-step you into it. And so the pearls that we use, I think, are 1,000 milligrams in each one. We'll try that. And if you still feel gassy, I have to take it with food. If that doesn't work, we'll have flax.
I could deal with. That's the other problem.
Yeah. So
the irritating part.
Yeah. Just if it's a nice, natural, pure form, it's surprising. But everyone's chemistry is a little different. Like I said, even with the Nordic Naturals, we had a few patients that had problems with even that.
I don't know if that stemmed from the fact that I've got 14 inches less of colon than I had before.
Yeah, it shouldn't.
I don't think so.
That shouldn't. It shouldn't.
Just irritating.
It's probably even more important for you to eat omega-3 just because of the fact that you don't have as much of your colon as you used to have. But another thing that would be important for you to take, we're not talking about that, they are probiotics, which are the good bacteria that lives in your intestine, which helps your immune system function normally, helps with vitamin D production. The other thing you both ought to think about, I think anybody that lives in Ohio should think about is supplementing with vitamin D. I mean, there's been, if you'd asked me a year ago how much vitamin D you should take, I would have said 400 to 800 units a day is fine. But with as much medical research has been done in the past year, I'd say right now you should take, in this living in Ohio, 5,000 units a day. And if you're deficient in vitamin D, take 10,000 international units.
Vitamin E?
D.
Oh, D.
D as in dog, because it helps with the immune system, it helps form hormones, it helps your brain function better. Vitamin D is really chemically structured. It's really not a vitamin, it's really a hormone. tons of different things. You know, it's good for depression. It's like drinking sunshine or eating sunshine in a capsule form. So vitamin D is extremely important too.
Okay.
Yeah, and the absorbable form of vitamin D is cholecalciferol, vitamin D3. That's the kind your body can absorb, and that's the best kind to take. But D is extremely important.
You used to hear a lot about vitamin E.
Yeah.
Take loads of vitamin E.
Yeah.
But
vitamin E, you know, there have been several studies done, again, in the past 6 months or a year that have shown vitamin E by itself, you know, hasn't done much to help prostate cancer. Hasn't done much to help blood vascular flow or cardiovascular health. Vitamin E in conjunction with other vitamins, like CoQ10, it magnifies the effect of those vitamins. So vitamin E can be good, but I think vitamin E in itself needs to be taken with other vitamins. Plus, it's fat soluble, so you know you got to not take too much of it, because if you don't utilize it, you know your body doesn't use it for metabolism, and it gets stored as fat. But vitamin E is important. Vitamin E is a good antioxidant as well. So, you know, regardless of some of the studies that show that vitamin E hasn't been very helpful for anything, you know, really it is.
well, you don't want to overload your system with it, till.
No.
Used to, you'd take this bukus of it
Right.
way over what you
Right, but you know what? The other thing that's important too when taking any of the vitamins, whether it's vitamin A, D, E, K, B, you need to make sure you're taking a whole food vitamin that has all the complexes built within that vitamin. You know, a lot of vitamins, like vitamin E, the only thing that's in it that's in it that they can call it vitamin E is L-tocopherol, which is just one of the antioxidant coverings around the vitamin E itself. But you know, vitamin E, if I were to take it and dissect it and look at it under a microscope, there's magnesium in it, there's manganese in it, there's wheat germ in it. There's 7 different layers of tocopherols that support it and protect it, not just that one outer covering, which is what most of us buy. So if you buy a whole food supplement, it's got all those complexes in it, and then you'll get better use out of it. Which is why I think probably some of these studies that have come out recently that didn't really show that vitamin E was that helpful for anything, they weren't taking those vitamin E complexes. They only were using synthetic samples, and synthetics are not readily absorbed by our body.
He takes Proscar, did take Flomax for prostate. He's dropped the Flomax and is taking saw palmetto.
That's good. That's good.
I think it's working.
I
Yeah.
think it's as good as
That's good.
Flomax.
Yeah.
I took that Flomax for years and years, and then they done
He's got patients coming in.
Hey, you guys are good.
microwave treatment of pills and heat treatment.
Right.
It worked for about a year and a half. Then it started going down, which he said possibility it could.
Right.
And put back on Flomax. And I could get side effects from it.
Right.
Muscle pain.
You have a lot of side effects with a lot of medications.
Yeah.
So you
And,
definitely need to search natural.
I talked to people that was on saw palmetto, so I started taking it, and I got on good. But
Oh, good. Good.
His PSA was 3.5.
matter of fact, that saw palmetto brought it down more than what the Flomax did.
And you know, sometimes with the body, you just give it the right fuel, and it knows what it needs to do. So,
I get it in bottles that comes in 60 grams, no 160, and I take it twice a day. And
good.
So,
Good. Hey, if it's working, that's good.
but I found I had some of 60, but, and I take 2 of them a day, not to no difference. So up to double. It's okay.
Good.
Dr. Lewis, we
Good.
thank you.
Well,
Hey, thank you.
As the old song goes, we'll owe our soul to the company store one of these days here.
if you have any questions, I'll get you some not fish oil, and then to try, and then I'll get you a copy of that anti-inflammatory diet, because there's some good guidelines on there as to what's good to eat and what's not good to eat.
We don't need both of
Okay,
these.
we don't say we don't need.
You can take them if you want to. You can give them to a friend. Because you can just about read that thing and you'll know exactly what's in it.
I wasn't aware there was coconut oil. That was interesting.
Most grocery stores now have organic sections, and usually can find the inorganic sections of the stores. Same thing with coconut flour. If you're not eating, because a lot of people are real sensitive to grain, gluten, and that's another choice for flour.
Okay, thank you.
All right.
Okay, thank you.
See you guys.